Good afternoon. This is Peter Thomas, the General Counsel to the NAAOP. There's a tremendous amount of policy issues pending before the orthotic and prosthetic profession and community overall. Just think about this. BIPA 427 regulation, prior authorization of DMEPOS, the local coverage determination in draft form that is still pending, a whole number of other issues including competitive bidding and VA issues. They seem to be stacking up, and there are pieces of legislation that NAAOP, in working with its O&P alliance counterparts and sister organizations and AOPA, have been pushing forward and trying to promote and get on the map and ultimately trying to move forward and solve some of these problems. Recently, a O&P policy forum was held in Washington, D.C., spearheaded by AOPA, in which NAAOP participated, as well as a number of the other O&P alliance organizations. And I'm very pleased to say that finally I think we're starting to see some break in the logjam and some real development in pushing some of the solutions that are so needed in the orthotic and prosthetic field. I'm going to highlight three of them. The first is BIPA 427. What does BIPA 427 even mean? Well, it's an acronym for the Benefits Improvement and Protection Act of 2000. And Section 427 of that law, which passed 16 years ago, calls on CMS to implement regulations, within a year, by the way, to prohibit Medicare payment of prosthetics or custom orthotics to anyone but a qualified practitioner or supplier. In order to be qualified to receive Medicare payment for these services and devices, a practitioner or a supplier needs to be state licensed in O&P or accredited by ABC, BOC, or an accreditor that has standards that are essentially equivalent to those two accreditation organizations. The problem is that CMS still, 15 years after they were supposed to, has not issued federal regulations implementing this proposal, this law. It's a federal law that currently is supposed to be implemented by CMS, but it has not been. The NAAOP, along with all the alliance partners, have been pressing CMS and Congress for years to try to get this implemented. I'm so pleased to say that finally we're starting to see some light at the end of the tunnel. It's our understanding that this proposed regulation sits currently at the Office of Management and Budget, OMB, which is the White House's budget office. This is the last stage in the process before a proposed regulation is issued in the Federal Register and put out for public comment. We expect the reg to be issued by the end of May, and we will most certainly be analyzing the regulation and respond to it forcefully, and we hope that you will help us respond. That's number one. Number two is the local coverage determination. As people know, as a result of the draft LCD on lower limb prosthetics that was introduced by the DMAC medical directors last summer, there was a huge backlash against this LCD because it sent amputees back to a 1970s level of care. Well, I'm pleased to say that there's now legislation that's been introduced, H.R. 5045, bipartisan legislation introduced by our champion and our friend in Congress, Renee Elmers from North Carolina, and a new supporter of ours, Jan Schakowsky, a Energy and Commerce Committee Democrat, very engaged in healthcare policy from Illinois, and the two of them are sponsoring this legislation to do three things. One, put a moratorium on the LCD, the draft LCD, to make sure that CMS and its contractors do not implement this LCD while the presidential administration changes from one to the next. So this moratorium would apply through mid next year. The second thing the bill would do is direct CMS and its contractors to remove the draft LCD from their websites so that private payers could not adopt the LCD as if it were in final form, which, as we know, United Healthcare and Cigna have both done, with at least portions of the LCD. And then third, it clarifies that CMS, in fact, has the oversight authority over its own contractors when those contractors are drafting LCDs. Very important legislation, and I think it really bolsters a lot of our efforts to try to get this LCD turned back. Lastly, the Veterans Administration and NAAOP has been very familiar with VA issues and has been out front on the Injured and Amputee Veterans Bill of Rights. Again, Congresswoman Elmers has introduced this bill, H.R. 3408, and ultimately this is a bill that is not in this current Congress but was introduced in last Congress, and it would essentially do a number of things, but one of them is to preserve choice of provider, prosthetist, orthotist, outside of the VA system for someone that cannot get their needs met within the VA system itself. Both Senator Burr and Senator McCain have VA legislation that would make permanent the program to allow veterans to select providers of their choice outside of the VA program in certain circumstances. And we've been working with Senator Burr's office to ensure that prosthetists and orthotists are included in this list of providers that would be available to veterans if they chose to go to them. All of these developments are starting to gain some traction. We're very grateful for AOPA's policy forum that occurred in Washington this past month and frankly led to a whole host of new and exciting opportunities for the orthotic and prosthetic community, not the least of which is Senator Bob Kerrey's involvement. As you well may know, former Senator Bob Kerrey, himself an amputee and user of a prosthesis, has been very active and volunteering his time and has been a wonderful champion to highlight the issues involved in prosthetics and orthotics and try to bring some solutions to the many problems we confront. Thanks so much.